Good evening, everyone. Myself, ARSHDEEP Singh, Assistant Professor, Mira Medical Institute of Nursing at Hospital Bahut. So, today I'm going to explain you about a new topic that is nursing process, and the specific topic is community health nursing process. Okay, so nursing process is a very common topic in various subjects of the nursing, like the fundamentals of nursing and the fundamentals of nursing, community health nursing, or it is I would say it is very common in each and every subject of the nursing, or it may be asked in any of the question paper. So if you are going to attempt or give up any of the exam, this can be a common question that could be asked in exam at any time. Okay, so that's the reason I have chosen this topic. Okay, so the main topic is community health nursing process. So let's start with the topic. I hope you can see all the content on your screen. Either you are using the mobile phone or the laptops or the computers or monitors. Okay, so let's start with the topic, that is community health nursing process. So basically, community health nursing process is the specific topic of community health. And if talking about only the nursing process or the community health nursing process, these both the processes are similar. Just additional word used here is the community health. Okay, so rest all the points of the nursing process, as you can studying in the common topic of nursing process, are same. Okay, so let's start with the topic. So first of all is the introduction, that is prevention of illness and maintenance of health are common goal in all the areas of community health. Okay, so what is this? Is that prevention of illness and maintenance of health. Okay, so these are the common goals, because we have to prevent the illness. Okay, we have to I can say that the prevent the various types of illness, either it is communicable or non-communicable. We have to. Okay, so either it is any type of illness, or we have to maintain the health, we have to use the nursing process. Okay, Linda and Jarvis stated that the cornerstone of the nursing process is the cornerstone of the nursing practice is the nursing process. So we can say that the nursing process is the backbone of the each and every procedure of the care that will provide in we can say that in the nursing. Okay, so in order to realize the community health purposes and the goals, a nurse has to get things done in an orderly and systematic manner to plan need-based programs. So whenever the nurse is planning for something, or he or she has to assess something, so or I would say in each and every second of the nursing practice, we are in the need of the implementation of the nursing process. Either we have to assess something, either we have to plan something, either we have to plan for the interventions or implement, or either we have to assess for any type of procedure or evaluate that specific procedure, policy, of the program. So there is always the need of a single term, that is nursing process. Okay, so that was about the introduction of the community health nursing process. Next is about the definition. So first of all is the definition according to Eura and Walsh. Nursing process is an orderly, systematic manner of determining the patient's problems, making plans to solve them, and initiating the plan or assigning them others to implement it, and evaluate the context extent to which the plan was effective in resolving the problem identified. So as you can see this definition, so this definition contains all the steps that I will explain you in the later scenario. So nursing process, what is nursing process? It is the orderly and the systematic manner of determining the patient's problem. Firstly, we assess the patient's problem. Secondly, we make the plan to solve them. And thirdly, we assess and what we have assessed and what we have planned about the intervention. Then we implement this and appoint some of the nursing personnel that they will implement these type of interventions or the services to the patient or the family or the community. And after that, after implementation of these types of problems and the various problems, at the end we will do a evaluation that rather our assessment was correct, or the patient is getting any of the benefit that what we have planned. So that is about the nursing process, about the definition of nursing process. So a line uh, a line is written here like the community health nursing process is the scientific method of assessing and solving the health problems of the community. So all the steps are same, and community health nursing process is a scientific method by which we assess the various types of problems of the community and solve these types of problems of the community by using the nursing practice. So that is the definition of community health nursing process. So one more definition is community health nursing process is orderly, systematic, rational method of planning and providing care for the prevention of disease and promotion of health of the community. So as it is clear from the definition, like we have studied about the nursing process, the same content is written here by just adding the one word, that is community health. Okay, it is also the orderly, systematic, rational method of planning, then providing the nursing care based on that planning and evaluating that specific intervention and what we have achieved after the implementation of this process. This is known as the nursing process. Okay. Next, I will talk about the concept of the nursing process. That what is the main concept behind the nursing process? Why we are using this type of process in nursing? So the nursing process consists of 5 interrelated steps like assessment, diagnosis, planning, implementation, and evaluation. So these are the main 5 steps that you have to write in exam, and you have to explain these according to the examination point of view. So these are the 5 steps that we explain under the nursing process, and this is what the infrastructure of nursing process is. It is a systematic, dynamic way of giving care. So by the use of these steps, we provide the care to the patient or the community or the individual. And central to all nursing approaches, the nursing process promotes humanistic, outcome focused, and cost effective care. So we provide 3 types of care by the using of this process. That is, first is humanistic, second one is outcome focused, and third is the cost effective care. So this is the concept of nursing process. That main concept is to provide a systematic and orderly manner uh, nursing process, uh, nursing services to the community of the individual. Okay. Next, yes. So next is about the objectives of nursing process. Okay. So it's a lengthy topic, so I will try to complete it in the 2 parts. Okay. So today is the part 1. Second is about the objectives of community health nursing process. So what community health nursing practice wants to achieve. Okay. So first of all is to identify the community's actual or potential health problems, healthcare needs. So it is very obvious that we have included the first point of the community health nursing process is assessment. So we will assess that what type of various problems are there in the specific community by which the various people are uh, getting affected, like the type of the communicable diseases or the non-communicable diseases. Are there any type of sanitation problems or the environment related problem or the problems related to the lifestyle or any other type. Okay, so by the use of the assessment technique, we just come to know about the various type of sufferings that community people are suffering, or they are getting infected from any type of infection or any other thing. So first point is to identify the community's actual or potential health problem. What are these problems and how they are affecting the community? Second one is to formulate nursing actions to meet out the identified community health needs. So if we are having the data related to the assessment, that we are assessing something, okay, so then we can have the, or we can formulate nursing actions, like we can plan the various types of interventions based on the priority, like if there are different types of problems, and there are different types of communicable as well as non-communicable disease, but we will see, or we will assess that which type of disease is present in the community, and that mostly that is affecting the more number of people. So we will set that type of specific disease as the priority, and will plan the various types of interventions so that we can prevent the cases related to that specific disease. Okay. Third is to deliver nursing interventions to fulfill the needs. Okay, so we have assessed the various problems. Then we have now we know about the various types of needs. Then we will plan the intervention. So that is the third objective of the community health nursing process, to deliver the various types of nursing interventions or the care of the services. Last one, if you have done so much that you have assessed, you have planned, and you have interventions and you have implemented them. So at the last, you have to evaluate that what was the result of your planning or the policy making. So that is the last objective of community health nursing process. Okay. So that was about the objectives of community health nursing process. Next is about the importance of community health nursing process. So some of the points are written here. So by which explains that why the community health nursing process is so much important. Okay. So firstly, let me tell you that this is a very important topic, and this could be asked in any of the exam of any of the course of the nursing, like ANM, GNM, BSc, or the post basic, because this is a basic theory, I would say, or the basic technique of performing various types of nursing care services. We have to use this process in each and every context. Okay, so that is a very important topic, and it might either be asked in 15 marks, 7.5, or 5 marks. Or 5 mark is a very common type of the question technique in which this type of question is asked, right? Like write short note on the nursing process, and so you have to write about the nursing process. Okay, so listen carefully, and you can also get the prints or the screenshots of this content. Okay, next is about the various points. So following point shows the importance of the community health nursing process. What are these points? First is community health nursing process provides care that is continued and community oriented. Okay, so that's a very important point, that nursing process is always a dynamic process. It changes according to the situation. Like the steps are not changed, like assessment to evaluation steps are same, but the condition changes and the policy or the assessment techniques are changed. Okay, so the objective and the importance is same. Okay, so it is according to the community or the individual, and it is a continual process and community oriented based on the needs of the community. Okay, next is about the second point is it uses resources which are available in the community. Okay, various types of resources are available in the community, and the nursing process use that specific type of resources that could be used for the providers of the services to the community people. Okay. Third is it improves the functioning of the community health team. So it is, as we have already studied, that it is a systematic process. Okay. So it improves the functioning, and it also gives the effective results. Okay. Next is about community participates in each step of the community health nursing process. So in the nursing process, when the persons who are the beneficiaries for the specific services, they take part or they participate in the specific program, so that program becomes successful. So in the nursing process, the community health nursing process, the community members also participate, as well as the nursing process personnel also participates in the specific process. Okay. Next, community health nurses have job satisfaction because it is a we can say that the oriented, or it is a systematic process. So nurse feels very comfortable and perform this type of nursing process by providing care, and each and everything is sought out, and if there is any type of problem related to the providence of the care, that could be sorted by the use of this nursing process. So there is a job satisfaction. Okay. Next. Next is it helps in professional growth of the community health nurses. It is obvious when you are providing the care based on the specific principles. Okay, so it helps in the professional growth of the community health nurses. It would help because there will be the it will decrease the mistakes or any type of duplication of the work, and it will also provide a systematic manner to collect the data and provide to the provide care to the specific patient of the community. Okay, next, it provides quality assurance in community health nursing. So it is very obvious that if you are doing or performing something in a systematic manner, the quality will automatically increase in that specific work. So it also provides the quality assurance. Okay. Next, it increases community health status and make community self-reliant. Okay. So it increases the community health status and it increases the belief of the community in itself. Okay. So these were the some of the points that why community health nursing process is very important. Okay. Next is about the various types of components and the phases of the community health nursing process. Okay. So this is about the main content, that is component and the phases of the nursing process. As I have already explained you and told you about these components. So let's see it again. First of all is the establishing and maintaining working professional relationship. Okay, so that is the first step or the phase in the community health nursing process, that you have to make a IPR with the family or the individual or the community. Okay, second thing, community health nursing assessment. When you have established a IPR, then you have to perform the nursing assessment. You have to collect the various types of data that are required by you for the providers of the package services. Okay, third is plan community health nursing actions based on that data that is was available to you by the use of the assessment techniques. You have to plan, or after the assessment you will get to know about the various type of need of the community. So based on that need, you have to plan the various types of nursing actions. Okay, next is based on the planning, you have to implement that planning and the intervention that you have planned for the removal of the various types of barriers that were acting as a barrier in the providence of the nursing care, and that was like the various problems that were community suffering from. Okay, last is evaluation of the community health nursing actions. So if you have implemented all this, at the end you will check for your result, and that is the process of evaluation. And that was about the component and the pieces of community nursing health nursing process. Okay, so that was in short at what community health nursing is and what are the objectives, what is the importance of the purpose. Okay, so that was a content or introduction about the community health nursing process. Okay, like a diagram is there, like you can see nursing process in the community health nursing. These contain all of the steps. Like as you can see, first step will start from the lower left, that is maintaining working professional relationship. That is the first step. Second one is the community health nursing assessment and nursing diagnosis would be made after the uh, after we have made a IPR with the community. And third, based on that assessment, we have to plan community health nursing action. Like we have to make the interventions, and after that we have to implement these. And at last, we have to evaluate the basic results. Okay, so that was all about the phases and the okay in short. So let's start with the each and every step in detail. Okay, so in today's lecture I would only complete the part one. Okay, so some of the points will only be explained by me in this part, and rest of the topic will be explained in the second part. Okay, next, about talking about the first step, that is establishing. Yes, so thanks for the comment, Gagan Khan. Thank you very much for the appreciation. I'm really honored. Thank you very much. So next is establishing and maintaining a working or the professional relationship. So that is the first point in the community health nursing process. So this is the first most important step. Community health nurse has to work with clients, families, and the community. Okay, and she can work with them successfully if she develops a working relationship with them. It is obvious that uh, with each of the member with which you are working or to whom you are going to provide the service, you have to be in a good relationship. Like there should be a IPR, interpersonal relationship between the care provider and the care receiver. Okay, so that's the first step. Second one is the second step that is really important is community health nursing assessment. Okay, so that is the very important point. Like if there is a mistake or there will be a mistake in this step, you will get the wrong data, or the data will not be based on any of the factual information. So all of your planning is based on this step, and if this step goes wrong, you will have to revise your all the steps, and this would take a long time, and that would not give the effective result. So this step should be performed in a effective manner. Okay, and the assessment of the health and nursing situation is very essential to provide need-based care to the community. And according to Webster, assessment means judgment of the importance, size, or value of the something. It is an act of appraisal, and assessment includes three major activities. So, what assessment actually means, it is a judgment of the importance. We are giving priority to we assess about the needs of the community. In this, we assess about the needs of the community members, of the individuals, that what are their needs? Are there any needs related to the physical dimension, or mental, social, or spiritual, or any other that either of the problem related to the health? So, we have to assess for that condition. Okay, so it involves three steps. First is the community identification. Second is the assessment of needs and problems. So first of all is the community identification. It is the first level of assessment phase. So it includes collection of the pertinent data about community parameters and analysis and interpretation of the data. So in this, we include that what type of population we are going to deal with. Okay, so are they the group of the males or the females? Now the problem is related to the male or female or the infants or the toddler or the preschool or senior citizen or any other type. So what is about the in this in which we include the type of the population, or we can say that the various types of community parameters. Okay, so we identify the community in this step. Second is assessment of needs and problems and prevailing in the family, in the community. Okay, so various types of needs and problems we assess. Firstly, we assess the community. Secondly, we assess that what type of needs and problems are prevailing in that specific community that the people are suffering from. Okay, and third, make community health diagnosis. After the assessment, when we are having the data related to that specific assessment, okay, so we would make the nursing diagnosis that the whole of the community is suffering or is affected by this specific or these some of the problems. Okay, so that will be the community diagnosis. So that is the step of community health nursing assessment. Okay, clear? So that was all about the community health nursing assessment. Okay. So some of the important points in this point, that is assessment, is that what first step, that is community identification, what type of things are included in the community identification. So it is planning for the collection of the major categories of the information. So the data or the vital statistic, or that would include the various types of vital statistics or the type of the population for which you are going to collect the data. Second, the type of data and methods and tools of data collection. Are you using any type of survey technique or questioning or any other type of technique? Okay, interview method or the different types of methods. Okay, are you doing the physical examination, that is head to toe examination, or any other type of method? Next, third is collection of the data is included in that, and then data analysis and interpretation, and community profile and diagnosis is included in the community identification. Okay, next, Next is about the planning for the data collection. Okay, so how would we plan for the data collection? So we have to collect, plan for the data collection. So what are the various things, the points that how can we collect the data? So major categories of information required. So first of all is the what categories, the major categories that about which we have to collect the information. So firstly, we have to assess for that concept of community and community health determinants from the basis for the community form the basis for the community identification. So, community and the community health determinants. What are the determinants? Determinants are those factors on which the health status of that specific community is dependent. Okay, so we have to find the data related to those factors. Okay, a major category of information are derived from these and are discussed relevant to the three dimensions of the community. So, from which so what are the major categories for which we have we always collect the data? Firstly, the community core, that is the aggregate of the people. Second is the environment, and third is the social system. Okay. So first point include the aggregate of the people. So that includes the vital and the demographic statistics, that is density of the population. What is the density? And is the population composition that I was talking about, that is sex ratio, age distribution, children below 5, 6 to 14, 15 to 45, 46 to 60 and 61 plus. Okay. So one thing you have to keep in mind that we are talking about the community health nursing diagnosis. So this we are not taking a single person, we are taking whole the community under this process. Okay. Then next is a race distribution and ethnic origin of the caste. And then we will take the population characteristics, that is the dependency ratio, fertility rate, birth rate, growth rate, mobility, socioeconomic status, level of the employed, literacy rate, marriage rate, divorce rate. So we will also collect the information related to this data. Okay. Next, we will take the data about mortality characteristics like true death rate, that is pure death rate, infant mortality rate, maternal mortality rate, age specific death rate, and leading causes of death. So, what are the main factors or the leading causes of death in that specific community? Okay. Next, data related to the morbidity characteristics, incidence rate, okay, the specific disease and the prevalence. Incidence is the total number of new cases. The prevalence is old plus new. Next is history of the community and values, attitude, norms, and custom that are on that on which the specific community people live. And next is the families. For example, the type of families, size of the families, and number of children per family, and religion and religious activities. So this would be the data for which that includes in the community identification as the under the heading of aggregate of the people of the demographic characteristics. Okay, so that was all about the today's part. That is part one about the community health nursing process. So rest of the topic will be explained in the next week in the second part. So for the time, thank you very much everyone for your precious time. Thank you. Thank you very much.